Autism and ADHD or ADD go together more often than you might think. Some studies show that 30 to 50% of people on the spectrum also show signs of ADHD or ADD, and up to 2/3 of the population of people with ADD or ADHD also show symptoms of being on the autism spectrum. This is an important relationship that we're going to start exploring today by diving into the 7 different types of ADD as defined by neuropsychiatrist Dr. Daniel Amen. In this video today, we're going to talk about the difference between autism and ADD or ADHD. We're also going to explore all 7 types of ADD as defined by Dr. Daniel Amen. We'll talk about some things that you can start doing today to manage symptoms of ADD and ADHD. And if you stick around until the end of the video, I'm going to be sharing with you an online test that you can take today to explore which of the 7 types of ADD you may or may not fit into. This is a super important topic to talk about and one that I get really excited about, and I can't wait to share the things that I've learned about this topic with you. Let's get started. If you're new to my channel, welcome. I am so glad you're here. I am Taylor with Mom on the Spectrum. I started my channel because honestly, I just love talking about mental health. I feel like it's something that needs to be talked about more. Mental health conditions are just information that help us learn more about ourselves and the world around us. And I think it's important that we start normalizing these conversations. I also wanted to help make resources more available to autistic adults, as I was diagnosed later in life at age 31 as an autistic female. You can help me normalize the discussions around mental health by liking this video if it's helpful to you, making sure that you've subscribed to the channel, and taking part in the conversation below in the comments. All of these things help my videos show up for more people like you and me and make these resources more readily available. As I mentioned in most of my videos, I'm not a doctor, I'm not a psychologist. The purpose of this video is to inform and educate. I'm sharing things that I have learned in hopes that they can also help you. But if you choose to make any changes to your own personal health based on this video, please do so with the help of your healthcare provider. As I mentioned, we're going to be discussing the 7 types of ADD as defined by Dr. Daniel Amen. He is a pioneer in the field of neuroscience because of his work with SPECT imaging. It stands for Single Photon Emission Computed Tomography. These brain scans have really opened up the possibilities of understanding more about what is actually going on in our brains and how to diagnose and treat mental health conditions. Dr. Amen has used thousands of brain scans to categorize ADD into 7 specific categories to gain a better understanding of how it works. He has also developed 7 highly specialized treatment plans for each of the different presentations of ADD. Make sure you check out the description under this video. I'm going to be posting so many resources there with more information on this topic for y'all because I cannot cover it all in a video today. I decided to focus on Dr. Amen's work because he is a little bit of a personal hero of mine. His book stood out to me one day when I visited a bookstore and I saw it sitting there on the shelf. It said, "Change your brain, change your life." And it spoke to me because I have always felt like my brain operated in a way that I just couldn't understand. And if I could somehow gain some control over the way that it functions, it would really add to my overall well-being. I love his approach because I feel like it's very holistic. He believes in the power of food to change our bodies. He believes in the power of medicine to change our bodies. He's very compassionate in his approach, and he really helps his patients integrate different aspects of their life, not just medicine and physical health, but also relational health, spiritual health. It's a very holistic approach that really fosters an environment for overall health and well-being. That being said, most of the information that I'm going to share today is from his book, Healing ADD, which I'll post a link to in the description, and also from his website for Amen Clinics. Okay, first let's talk about the difference between autism and ADHD. I'm reading off my notes because my executive function is not allowing me to remember things right now. Autism is a complex developmental condition involving persistent challenges in social communication, restricted interests, and repetitive behavior. And the impairment in functioning in each of these areas can differ vastly depending on the person. ADD, or attention deficit disorder, is a term commonly used to describe symptoms of inattention, distractibility, and poor working memory. ADHD is the term used to describe additional symptoms of hyperactivity and impulsivity. So ADHD is attention deficit hyperactivity disorder. That's a lot to say. Both autism and ADHD are neurodevelopmental conditions. Neurodevelopmental just means relating to the development of the nervous system. Sometimes the symptoms with autism and ADD or ADHD can overlap, and it can be difficult to distinguish between the two. At other times, they can feel like polar opposites, and it can make someone who has both of these conditions feel like they're stuck between gears and don't know how to move forward. I'm going to be tackling that topic more in another video. Today's video is mainly just to better understand the 7 different types of ADD. Why is it important that we talk talk about ADD. According to recent studies, less than half of people with ADD are actually being treated for ADD symptoms. This probably won't come as a surprise to you, especially if you've been on the channel for a while, but females with ADD are underdiagnosed. This might be due to the fact that many females present without the hyperactive component, and this causes them to draw less attention to themselves. Left untreated, ADD can cause some significant problems in navigating everyday life. These statistics are pretty crazy. 33% of people with untreated ADD don't finish high school. 52% of untreated teens and adults abuse drugs or alcohol. That's a really high number. And also, people with ADD tend to have more medical visits and get injured up to 5 times more than people without ADD. I found this picture on Dr. Amen's website, and I wanted to point out how interesting these brain scans are. The picture on the left shows the brain of someone with ADD at rest, and the smoother the surface, the healthier the brain function. The picture on the right is that same person trying to concentrate, and you'll notice that it's bumpier, that it's not as smooth across the surface, and it almost looks like there's some holes. These aren't holes in the brain. This is just a representation of how the brain is functioning. There's less action in the prefrontal cortex, which makes it much harder to concentrate. So overall in ADD, there tends to be less blood flow to these regions of the brain that help us control impulses, plan, make decisions, and concentrate in general. In his book, he goes into brain scans for each of the 7 types, and they can differ a lot. So if you're interested in learning more about that, I highly recommend that you buy his book. All right, the first type of ADD is classic ADD. This is usually evident early in life, and this is what many people might refer to as ADHD. It's got the classic hyperactivity component, but it's not always present. Other characteristics of classic ADD are being inattentive, distractible, disorganized, restless, and impulsive. The second type of ADD is inattentive ADD. This is characterized by being easily distracted with a low attention span, but not hyperactive. Instead, someone with inattentive ADD might appear sluggish or apathetic. They may also appear quiet or introverted. They don't tend to draw negative attention to themselves as much as someone with classic ADD. The third type of ADD, overfocused ADD, excessive worrying, argumentative, and compulsive, often gets locked in a spiral of negative thoughts. People with overfocused ADD might have difficulty shifting their attention. They may perseverate, which is something you may have heard when studying autism. Perseveration is getting stuck on a topic and not being able to get off of it, not being able to shift gears to something different. So you might already be seeing some overlap between autism and ADHD on this one. Overfocused ADD tends to be found in substance abusers or children and grandchildren of alcoholics. The fourth type of ADD is temporal lobe ADD. This is classic ADD plus quick temper and rage, periods of panic and fear, mildly paranoid. It's not unusual to see this type in people with head injuries. The fifth type of ADD is limbic ADD. It's characterized by moodiness, low energy. You may be socially isolated. You might have chronic low-grade depression, frequent feelings of hopelessness. In this type, the prefrontal cortex is underactive when concentrating, and the deep limbic area, which controls happy or sad, is overactive. You may have noticed with this description that it also sounds a lot like depression. It's very important if you're going to be diagnosed with this particular type of ADD that you have someone who really knows what they're talking about and can differentiate between depression and this type. It looks like it really comes down to the developmental history of the individual combined with the brain scan that helps differentiate between the two. The sixth type of ADD is ring of fire ADD. This is characterized by being angry, aggressive, sensitive to noise, light, clothes, and touch. They're often inflexible, experiencing periods of mean, unpredictable behavior and grandiose thinking. In general, it's a pattern of high overactivity in the brain. If you have ring of fire ADD, you might feel overwhelmed with thoughts and emotions, and this particular type can be closely related to bipolar disorder. The main difference between the two would be that ring of fire ADD is more of a persistent condition, and bipolar symptoms tend to be more cyclical. You might notice some crossover with the ring of fire ADD and autism in terms of being really sensitive to light and sound and touch. I just wanted to point out that similarity there. And then the seventh and last type of ADD is anxious ADD. It's characterized by feeling anxious, tense, nervous, predicting the worst, getting anxious with timed tests, social anxiety, might often have physical stress symptoms such as headaches and gastrointestinal issues, and this type might also be conflict avoidant. So now that we know more about these 7 types, what is the difference between actually having ADD and just having moments where it feels like ADD? If these symptoms are present so often that you are having difficulty doing normal things in life, keeping relationships, going to school, keeping a career, that's when you know that you're dealing with more of a condition rather than just moments of feeling scatterbrained or disorganized. It's whenever it interferes with your daily life in a way that is consistent and has gone on for as long as you can remember. Can ADD be cured? That is a big question. And Dr. Amen's book has quite the title, Healing ADD. The stories that he shares in that book are phenomenal. And through his practice, he has found with lifestyle interventions, dietary, medicinal, sometimes interventions, drastic improvements can be made. Some of the areas that Dr. Amen focuses on when treating ADD: educational plans, emotional and social support, physical exercise, mental exercise, social skills strategies, coaching, self-regulation exercises, exploring supplement options, also exploring medication options, and learning more about neurofeedback strategies that can help you manage these symptoms. I also wanted to share this brain scan that I found by Dr. Amen that shows the brain off of Adderall and on Adderall. So you can see the difference here that the brain is much bumpier without Adderall, and then on the drug, it actually becomes smoother. It looks like the brain is able to work a little more easily whenever it has this medication. I think that's fascinating. I know that sometimes taking medication can be a really big decision, and I think it's important to consider your options, because if your brain can work better and offer you a better quality of life, I think that's something worth exploring. And many times, Dr. Amen has seen drastic improvements without the use of pharmaceutical drugs. I have a few tips that Dr. Amen has shared that you can start doing today to start managing ADD or ADHD symptoms. Before I jump into those, I just want to remind you real quick that I'm not a doctor, so if you decide to implement any of these things in your life, make sure that you do so with the help of a doctor. And also make sure that you research how much to take of any supplement that you might choose to start taking. First of all, you can take a multivitamin. He also recommends taking fish oil every single day. Totally eliminate caffeine. I know that that's a really hard one to do because some of us really love our coffee and tea, but caffeine restricts blood flow to the brain, and it really can exacerbate ADD and ADHD symptoms. You also want to exercise daily. For me, this is one of the most important things that I cannot recommend enough. I have to exercise a lot in order to tame my brain. So if that's something that you aren't already doing, even just walking outside for 20 minutes a day can really change a lot. You also want to limit screen time. Womp womp. I know that's a major bummer, but you know how it is. Being on a screen really challenges our brain in terms of staying focused. It makes concentration harder, and people who deal with ADD and ADHD just don't need any more opportunities to struggle with that. You also want to be really mindful about the foods that you eat. In general, people with ADD or ADHD tend to do better with a higher protein, lower carb diet, but this isn't true for every type, and if you want to learn more about how to eat for the specific type of ADD that you resonate with, you can find out more information about that in his book. And then lastly, you can take this online test to see which of the 7 categories that you might fall into. To take the test, you can go to addtypetest.com. It's a little bit lengthy. It's 70 questions long. For each question or statement, you're going to answer if that's applicable to you: never, somewhere in the middle, or always. And after you do that for all 70 questions, you're going to be presented with a screen where you can enter your email address, and then after you submit that, you'll be able to see your results. Here you can see that you might get a combination of several different types of ADD. I was just answering questions quickly to get to the end here, so this isn't representative of my brain, but it is possible to resonate with more than one type of ADD. As a reminder, I want to let you know that each of these 7 terms, and the term autism while we're at it, they're all made up terms, right? A human made these words up. They can be helpful when it comes to understanding more about our brains and how we interact with the world, but it's just that. It's a word. And there are many implications that society has given to these types of words. So I want to encourage you to latch on to any terms that are helpful to you and help you understand yourself better. Know that at the end of the day, we're dealing with a human brain inside of your body that is fascinating and complex and can't be defined just with 1 or 2 terms. But these things can help us learn how to better integrate ourselves into society. They can help us learn how to be more successful in our education, in our careers, in our families. But I believe that regardless of the challenges that you face, that your brain is beautiful. Together we can learn how to better understand and utilize the incredible tool that we have in the brain that we've been given. And that journey is going to look very different from day to day. Growth is not linear. I don't know who needs to hear that today, but growth is not linear. And just because things aren't looking better today than they were yesterday, it doesn't mean that you're on the wrong track. It just means that today might be a little harder than yesterday was with a few different challenges. I'd love to hear your thoughts about this video in the comments. I really enjoy interacting with all of you and learning more about each of your unique perspectives. If you enjoyed this video, please consider supporting me on my PayPal account, paypal.me/momonthespectrum, I love researching this stuff, but right now I'm really just kind of doing it for fun, and your support means the world. If you can't donate financially right now, I'd really love it if you could like this video, make sure you're subscribed to the channel, and share any videos that are helpful to you. Also check out my website, momonthespectrum.net, for more resources. Thanks so much for watching, and I will see you in the next video. Bye!